What's going on, guys? XQ420 here. You know what the deal is. I'm back. I'm in the building. I'm holding things down. I'm keeping things right, keeping them tight. First time to this channel, you know what to do. Smash it. Smash that subscribe button for me. Today's video. They keep telling me COVID, hospitals overran. We're in the height of this. New York was one of those places that got supposedly overran. And they built some extra centers. Let's see how they used them. Let's go ahead and jump into this. All right, article right here from the Blaze. Temporary pandemic hospital in NYC cost $52 million to build, and it treated 79 patients and closed a month later. Huh. Now look, guys, hey, they keep telling me, oh man, the hospital's overran. It's a pandemic. And so they went out here and blowed $52 million and seen 79 people. Okay, let's jump in this article. Maybe there's something else in there I'm missing. It might be something I'm missing. That's why we like to read this. Me and you together. We like to get in this together. So this said, in a startling waste of taxpayer money, a temporary pandemic hospital constructed in New York City cost $52 million, but in the end served only 59 patients before closing its doors a month later. So, okay, guys, like I said, 52 million, saw 79 people. Okay? That's not a good ratio as far as money goes. Here's what I'm saying. Where'd all this money go? I mean, it looked like from what I seen, just looked like some bed sheets and some pole. I mean, 52 million sound like a little embezzlement to me. I don't know what y'all think. Think somebody's embezzling. It's just what I believe. Hey, YouTube. Not making an assertion, just asking a question. You think somebody might be embezzling? I'm just saying. So it said, according to a recent New York Times expose, the hospital, which was built at the Billie Jean King National Tennis Center in Queens at the height of the city's outbreak, should have been a success story. It opened at the height of the pandemic with a full staff eager to treat the virus patients. Now, okay, so full staffed, they eager. I mean, they were looking at the chomps. I wonder if they all wore masks before anybody came in there. I don't know. At the height of the pandemic, you don't need to wear no mask. What's wrong with you? Now all of a sudden we gotta wear one. I'm like, hold on a second. When everybody was dying, you didn't want me to wear one. Now the death rate dropped 93%. Now I got the mask up. I told you, y'all seen my mask going out looking scary. Folks, they might deny me entry on that. So they said, but instead it only served as an illustration of the missteps made at every level of government in the race to create more hospital capacity amid the pandemic. Yeah, because here's what the problem is that you got governors and mayors and stuff thinking that they know how a hospital runs. They've got no clue. Let the hospitals do their thing. You act like this is the first time they seen some folks get sick and come in there and they'd be just a touch overwhelmed. That's how they make money, dude. They have all these other procedures going on as well as the ICU. But you know what? You got a whole bunch of people that want to know everything. And I'm a proponent in life. You ain't got to know everything. Let some other people know some stuff. And get your hands out of everything. Because all you do is just tear stuff up. That's all you do. So this is the Times report that the state paid as much as $732 an hour for doctors to essentially do nothing but paperwork at the facility. $732 an hour. All right, hey, look, I'm in the math right now. This is type of thing I'm doing. I just want to say they work in a normal 40-hour work week. Let's see how much that is. All right, so we're going to do 732. We do that times 40 hours. But the boys were making $29,280 a week to do paperwork. But there's folks losing their jobs. And we out here blowing $30,000 a week for one doctor. I hope that was more than one. 732. Man, I hope that was all the doctors combined. But still, $30,000 a week for the doctors not to do nothing. Man, I hope that was multiple doctors. I hope that wasn't just one, but I don't know. It says right here, I basically got paid $2,000 a day to sit on my phone and look at Facebook. $2,000 a day. Killing it, man. What? And this admitted Katie Capiano, a nurse practitioner who worked at Billie Jean King. We all felt guilty. I felt really ashamed, to be honest. Well, how ashamed are you? I want to know how much money you gave back. Hold on a second. Folks always tell me, "Oh man, I'm ashamed. Man, I didn't want to do it, but you know, I kept the money." Yeah, that's what I thought. Hold now, folks right now still ain't got the stimulus, the 1,200. Folks still ain't got the $600 unemployment. You were making $2,000 a day to type on Facebook. And everybody, look, man, I've been up there and I've been trying to get people to wake up. And they just been totally against me, man. I can't do nothing to get them to wake up. They keep viral load. Man, the viral load. Wear your mask, man. We at the height, man. ICUs. Shut up, man. Look at this. That's all you got to do. They give you the information, but they know you won't look at it. That's what the deal is. They will give you the info because they can't lie about it. They're going to put the actual stats out for you. But they know what, number one, folks don't know how to interpret it. And number two, I mean, folks are so scared right now that they'll just interpret everything as a bad thing. Dang, bud. I mean, this is pitiful, man. $2,000 a day. I mean, folk ain't making $2,000 a month. You're making $2,000 a day. Killing it. They said, knowing what our patients had to endure in an overcrowded emergency department, it's frustrating how few patients were treated at facilities such as Billie Jean King, said Dr. Timothy Tan, the director of clinical operations at the Queens Hospital Center Emergency Department, located just 4 miles away from the temporary facility. Now, here's my question. You know what I'm saying? So you got this one guy said, man, you know, we kind of were at our wits' end, but they wouldn't send him there. But you know where they would send him? And send him back into the nursing home. Now, isn't it kind of weird how California is coming up on the same amount of cases as New York? New York got 32,000 deaths, and California got less than 8. And said, hold on a second. What happened? You know, and I'm putting deaths like this with quotation marks. Man, I don't know who's actually died of COVID. And I don't know what COVID actually is. Because, man, it just got every symptom in the book, man. You just wake up in the morning, you sit, man, I might have it. But my back hurts. I probably got it. You know, the scarring. Man, stop. Man, don't you think when you get the flu and you get over it, you sick for 11 days, don't you think it might have scarred your body some? I mean, folks just act like this is the first time anything happened to anybody. And you're doing a disservice to people who have struggled with diseases, different diseases, cancer, all kind of stuff, and died in the past. We're just doing a disservice to them. Oh, they don't matter. Think about all the people right now who haven't been able to go in and get their cancer caught early. Those lives are going to be affected. Haven't been able to get certain procedures, been sitting at the house, hurting, depressed, all that stuff. I mean, don't nobody care about that. It's just one thing on people's mind right now. That's COVID-19. That's it. Well, 2 things. Black Lives Matter. And making sure the white supremacists get what they deserve. I mean, but it's ignorant, man. So this said the Queens Hospital Center was reportedly hit hard by the pandemic, operating at 3 times capacity in the emergency department at one point. I mean, 3 times capacity. Man, it seemed like they just have to kick folks out on the street corner. I guess that's what they're doing. Well, they're sending them back to the nursing home. So, I mean, it still don't make any sense why they didn't send it to... And they also had a naval ship. I don't know, man. Something don't smell right. But, folks, if you smell it, man, you need to be sniffing the air because something ain't right. So, they said different stories have emerged from the debacle. City officials say they didn't end up needing the space, while doctors say they were restricted from transferring patients by bureaucratic red tape. Huh. You see... Everybody's not able to come out and say, and people just be like, oh man, believe the experts. No. Who's paying them? Who's paying them? And can you get fired from your job for telling the truth? And are you willing to get fired from your job telling the truth? And when you do tell the truth, they're, oh, conspiracy theorists. You just a conspiracy theorist. You know what? You know what people call when people call somebody a conspiracy theorist, what they're just trying to say is that yeah, I know some shady stuff going on, but man, you can't put that out there. You can't put that out there. CIA made that up there so they wouldn't have to answer a whole bunch of questions. When you call somebody a conspiracy theorist, then you ain't got to answer the questions that follow. So they said New York City Mayor Bill de Blasio called construction of the facility crucial to the war effort during a news conference in late March. I guess just like painting BLM on the street. I mean, that's crucial as well. Man, those folks just doing all kind of dumb stuff. Fast forward to months later, an aide to the mayor, Jackie Bray, reported to the Times that the alternative space was less used than we expected it to be because we broke the curve. Thank goodness. Broke the curve? Man, you see, this is what I'm talking about. They're praising New York right now. I said, man, y'all know, but 32,000. And like I said, I don't know who was actually going to die already. But if we just go by the numbers they throwing out there, man, y'all did the worst out of everybody. Now they over here, they busting folks up for cases, but ain't a whole bunch of death. Hold on a second. So you gonna praise the people who killed off a whole bunch of folks, but you gonna condemn the people who just got a whole bunch of cases, but people are surviving. I got you. Okay, that makes sense to me. Said she added it was concluded that patients were often better served at their current hospitals. I bet so. Healthcare workers staffed at the Billie Jean King said even if hospitals were able to transfer patients, it would have been a while before the facility could take them in. Do what? What do you mean a while? You mean like 5 minutes, 20 minutes, 3 hours, 3 days? I mean, give me a time frame. They said extreme dysfunction, one doctor said about working there. Bureaucracy and dysfunction, and all kinds of barriers to serving patients. Why would there be barriers to saving lives? You see, guys, I done told you, man, they don't care about your life. This is the government. Man, when the government tells you that they care about something, just know they're lying to you. And just look into it, man. Smell it out. Fish it out. So they said, with several different sides to the story, it's difficult to know exactly what happened. But any way you slice it, taxpayers got burned. Well, we know what happened. Somehow $52 million vanished. That's all I'm going to say, but I don't see 50. Now, they probably had some medical equipment there, I guess. I don't know. Man, it's just some regular old bed sheets and some pole. So, I mean, to close this out, look, $52 million to bill, 79 patients treated. Folks getting paid $732 an hour to stand around and do a TikTok dance and punch on Facebook how they on the front lines and shoot a whole bunch of BS. That's all it was, man. But I'm just sorry, man. And I know people ain't gonna agree with me, but man, it's BS, man. The whole thing. And I was calling BS back in March when it began. Well, it didn't actually begin then. Actually, it was a little bit earlier when they would talk about it in China. And I looked it up myself because I was like, man, bro. Folks are getting rowdy about this virus. Let me look this thing up. And I looked it up, and it said fever and a cough. I'm like, what? Man, we need to move on. What y'all talking about? Man, I just had a fever and a cough 2 weeks ago. I got over it and moved on. Some people don't get over it. They don't move on. Man, that's the way life works, man. Like I said, we're doing a disservice to everybody else who's ever died before. Because, I mean, you weren't out there covering your face up and stuff like that to make sure you protected them back then. And you might have had the straight up funk. I mean, the stuff shared right, the viral loads shared right off of you, right in their mouth. Took them out. You ain't even know it. So, as you can tell, I'm fired up about this. Because, I mean, you got folks that, this $52 million could have went to some people who that saved their business. You know what I'm saying? Now you got people's lives destroyed. 52 million wasted. That could have been to save somebody's business. To keep people from having to go into forbearance. I mean, all kinds of stuff. And what was it done? Put in some doctors' pockets. And I ain't heard nothing about not one of them giving a dime back. Now, if y'all know something about them giving a dime back, put it in the comment section below for me. And you know, I always type down there. I'm in there. I'm commenting with you guys. So I hope y'all enjoyed the video. If you did, you know what to do. Like, share, subscribe. What are y'all's thoughts about it? I like to know in the comment section. I'll catch y'all in the next one. Peace out.